Hi guys, how are you? Dr. Pam, and thanks for tuning in to spending some time with me today to look at another question. Dr. Pam will always remind you that we truly do not believe taking questions over and over and over again is the best way to study. What we want you to do is to understand the content of the questions. So if you understand content and learn how to answer a standardized test, you'll pass the test. It is not an easy test. None of them are, but it is doable. We will say invest in yourself because you're worth it. Investing to us means really investing into some private, individual, or small group sessions. Many of you have spent thousands of dollars on materials, taking questions, and you really haven't done any better. You keep buying more material, and based on what we see, it's just not working. What we suggest you do is stop buying materials. We will supply you with materials. We will teach you what is on the test. We will teach you, well, I can't tell you exactly what's on the test, but I can definitely tell you the areas that will be on there. So what we do is if you come with us, we're going to pair you with one of our amazing, amazing coaches or tutors and coaching and tutors, and we're going to talk you through the test. We're going to figure out how you learn, what is your learning style, and then teach you content. It includes homework. We're going to give you homework every week. We suggest that you study 15 hours a week. For 90 days, we want to be the most important thing in your life. That's it. 90 days, 90 days. You'll never see us again. You'll never do the tests again. 90 days. That's all we want. We are committed to you. If you commit to us, we have an excellent passing rate and we can really help you. So again, invest in yourself. And for that means really investing in some private tutoring, small group, and really stop buying material. Stop taking questions. Stop just doing questions and think that's studying. You can keep taking questions all day long. And that does not mean that you've learned the material. That just means you increase your chances of getting it right because you've already chose A, B, and C. We had a client recently that said she didn't have any Freudian questions on the test. And I was very surprised. I responded that that's not possible. Freud is the father of talk psychology. He's the father. Before Freud came along, we did ice baths, we did lobotomies. So while you may not see Freud's name, you definitely will see psychoanalytic theory, which is where he started, where you could lay on my couch for 3 to 5 years, to now where it's psychodynamic therapy, where it's 12 weeks. But the goal is still bringing things from the unconscious to the conscious. So keywords include words like insight. All of my defense mechanisms are Freudian and definitely transference and countertransference. So really understanding, you will see those therapists, those orientations on the test. We're going to remind you that there are two types of test questions. There are questions that you have to really apply the information, and there are recall questions. So the steps of applying, and this is considered the social work helping process. However, we do the same thing with our NCE and our other tests. The first thing you're going to do is assess. You're going to gather as much information as possible. You get paid to be nosy. You chose this field because you like to ask questions, or as I'm going to say, the field chose you. Assess, assess, assess first. There's a couple of reasons why I can't assess. Remember, if it's full of feelings, if the client is boo-hooing, if they're throwing a chair at me, either one of those things, I cannot sit down with my pencil and paper and ask them, what happened when they were 3. And of course, safety trumps everything. When someone's life is in danger, when someone's threatening to hurt themselves or someone else, everything else stops. And then we make sure that we take care of that client first. Remember, our planning, our treatment plans, our treatment goals are made with the client, never for the client, never, ever, ever. However, it is very possible that we get clients that have unrealistic goals, and we're going to help them write SMART goals. Right? Specific, measurable, achievable, realistic, and time-based. Of course we are. Remember, your plan is based on the diagnosis as well as your intervention style. And many times the question will tell you that. It will say, according to this scenario, what do you do as a solution-focused therapist? Or using a feminist viewpoint, how would you treat the client? So the plan is based on the diagnosis, the presenting problem, And then the intervention, of course, is based on the theoretical orientation. That's why you have to know your theories so very well. Also, remember that termination starts at the beginning. Our goal is to get out of our clients' lives. We are not their buddy. We're not their pal. I know it feels like it to them, but our goal is to get in 12 weeks or whatever the treatment plan says and to get out. Of course, there are times that we have to change the treatment plan. We may have to lengthen it a bit because the client didn't meet their goals. We may have to change the goals too. Sometimes we get halfway through and we realize, this ain't working. Let's go back and change some goals. Those are all things that are very possible. We're always going to remember, and I'm going to remind you every time you spend time with us, it's a reading test. The words, the clues, the hints you need are in the stem. That's the meaty part of the question. That's how we practice. That's how we pass a standardized test. Everybody gets the same test, no matter where you live. And when I say the same test, I don't mean the exact same test, but the same type of test questions. So you cannot bring in what happens in your agency, what happens in your town, your city, what the rules are. You cannot bring this into the test. No one cares. It's about what does the code of ethics say, or what do the standards say of how we should practice. Every question is measuring a KSA, a knowledge, skill, or an ability of how clinicians practice. So the second way of answering questions are the Bloom's taxonomy. They're based on Bloom's taxonomy. These are our schema, as Piaget would say, our schematic, higher level thinking. This is how we think. Remember earlier, the test, and especially the NCE test, was written as a remember test. It was written as, tell me Freud's 4 stages. What stage of psychosexual development is this client in? And it gave you a brief scenario. Very, very easy. In the middle of COVID, that's when the NCE changed, and the social work test has been continually evolving to get to higher level thinking skills. What I hear a lot is the questions are vague. They are. You may never see a theorist at all. You may just only have to know the content. So that's when we're getting to applying, analyzing, and evaluating. Very few questions on the remember level. And many of you have spent hours and hours and hours memorizing Erickson's stages. And you've got some O-I-E-I, the letters, the acronyms. And I tell you, it's not going to help you. With Erickson especially, you get, and he used the word crisis, you get stuck in a stage. That means you could be 50 and still be in trust versus mistrust. So I really have not to only learn the stages, but I have to know what happens in the stages. I have to understand Erickson very well to be able to analyze, evaluate the higher end of Bloom's taxonomy. Okay, so as we take the test questions, we're looking for application questions that are really the scenario-based ones. And then many times we're looking using Bloom's taxonomy, where I get that one line sometimes. But either way, I still have to remember it's vague, and I'm looking to see, do I know the knowledge? It's a reading test. I will say it again and again and again. Let's start with this question. Your client, George, tells you that his mother just got remarried. He tells you that he is worried with the new husband's children, that the new husband's children are going to go after his inheritance. He tells you that he has very little contact with the new family and he wants to keep it that way. What is your legal obligation? I'm going to pull up the 4 answers in a minute, but if you want to stop the video right now, because I'm going to go over how we answer the questions. Okay. So as I read this question, some definite red flags stand out to me. It says, what are my legal options? I don't have legal options, do I? I do have some, right? Definitely, we have a legal option when it comes to duty to warn. If someone's in imminent danger, well, that's a code of ethics. It's also a legal option, right? A legal obligation. I cannot let someone just kill themselves. And not only will I lose my license, but I could end up in jail. Law trumps ethics. Okay. So my ethical obligation and my legal obligation are 2 separate things here. I'm not sure, as I'm reading this question, I see anyone in imminent danger. Okay, so that's what I'm thinking before I look at any of the questions. I know that his mother got remarried. It sounds like George may not be so happy about that. He's worried that his new husband's children, right, they might take the inheritance. I don't know, but my school of social work, or I don't think any in NC counseling school talks about what to do in legal obligations. I missed that day when I was supposed to go to law school. Okay. So again, remember it is a reading test. We're looking at specifically this content area talks about the law. So legal versus ethical. Remember that in some states, it is unethical. Well, in most, the Code of Ethics says it's unethical to sleep with a current client, right? That's unethical. However, in some states, it's also illegal. For the test, we follow the Code of Ethics. However, every state or many states have a jurisprudence test where you have to take the test regarding the laws in your state. So be sure that we don't confuse the two between laws and ethics. This one specifically asks me about my legal obligation. So my 4 choices are: I must assess for elderly abuse, including undue influence regarding the mother's estate. B, I should refer the client to an attorney to determine if he has a case. C, maintain confidentiality because you do not know the age of the mother. D, report elderly abuse regarding considering abandonment because he has very little contact with his mother. Now, as I look at these 4 answers, this is where we go back and we're trying to prove it in the question. No thinking. No thinking. I know what people say, well, maybe his mother is being abused. Maybe the new husband has come in and maybe the new husband has taken over her finances. Can I prove that in the question? If the question wants me to know that, they'll tell me. Okay? Don't add anything to the question. Read, understand what the question's asking you, and we're going to rule out 2 of the choices. We're always going to rule out 2 because it's much easier to understand or to figure out when I have 2. If you have those 3 question tests, I know it's easier just to rule out 1. Okay? According to the Code of Ethics, social workers as well as counselors have a strong ethical obligation to identify and report and to actively work to prevent elderly abuse. This includes prioritizing the dignity and worth of the person, social justice, and protecting vulnerable older adults from harm. It also includes assessing situations carefully, collaborating with other professionals, and advocating for appropriate interventions when elderly abuse is suspected. I understand that that is the law. That's an ethical as well as a legal obligation. I am a mandated reporter, mandated by your state and mandated, well, actually, child abuse is a federal law. Elderly abuse is a state law, but we are all mandated reporters. I understand that information, right? I'm not sure if I understand that in the question, right? So this is where we're back to. Now that I understand the content, does that apply to the question? So again, this is the understanding the content of this question is law and the limits to confidentiality and reminding us that we're mandated reporters. I'm going to repeat that again. That's not a test question, but just interesting to know. There's not a federal law regarding elderly abuse. There is a federal law regarding child abuse. Okay. So then what again I'm going to do is I'm going to go back to my question and I'm going to rule out 2. So I must assess for elderly abuse considering undue influence regarding the mother's estate. There's nothing in the question to prove that. There's nothing at all. Remember, I only have to have a reasonable suspicion. But George didn't say that his mother has bruise marks. George didn't say that his mother can't pay the bills. George didn't give me any indication that there's anything to worry about now. He's worried about his inheritance. So I'm going to take A out. I definitely can't prove that. You should refer to the client to an attorney to determine if he has a case. I like that answer. I like that answer, but I'm not sure if that's a legal obligation. Okay. C says maintain confidentiality because you do not know the age of the mother. I don't know anything about the mother in this point, do I? And D says report elderly abuse considering abandonment because he's had very little contact with his mother. That sounds good. But if I go back to the question, it only says he has very little contact with the new family. I don't know that that means he doesn't have contact with his mother. So I cannot assume that because it doesn't say that in the question. So I'm going to keep in B and C. I'm going to get rid of A. There's not enough room for me to assess. There's not enough room for me to call anybody to assess. Okay, so I wouldn't assess anyway. I would call somebody. And D, again, there's not enough proof in the question there's any elderly abuse going on. Financial exploitation is very true with elderly abuse. There's someone that could be taking her money, but I would have more proof in the question before I could prove that in the answer. So I'm going to leave it to B and C. When I get down to B and C, I always compare the two to each other and go back to the question. If you want to take some time to stop the video, to go back and help you decide for yourself whether it's B or C, please stop now. If you're with us still, we're going to remember that we've ruled out, we've gotten down to both B and C. And I'm going to remind you that we went back to the question to prove it in the question. We're not going to just stick between the answers. We're going to go between B and C and go back to the question, find the words that prove it. My answer is C. Were you surprised? Confidentiality, the code of ethics, emphasizes that counselors, social workers must respect a client's right to privacy and confidentiality, unless there's imminent risk to the client or others. I did not see anywhere in the question where there's any imminent risk. George is worried about his inheritance. My mom may not leave me any money. And while that may be something he needs to deal with, I don't have a legal obligation to do that. I can refer him to a lawyer if that's something he wants, but I don't have a legal obligation. I don't have to do that. Okay. Some of the reasons that the other ones are not right, if we go back and look at the explanations, okay, referring George to an attorney is practical advice, but is not direct advice under legal obligation, according to the NASW or the ACA Code of Ethics. Just not true. Your primary obligation to the situation is maintaining that confidentiality is clear unless there's obvious risk. No one is in imminent danger right now. There's nothing that I can share. Okay. So C is correct because I'm primarily aligned with confidentiality and the ethical guidelines. So when it came to the legal guidelines, again, law trumps ethics. So I would definitely follow the law if there's anyone that's in imminent danger, but there was no one in imminent danger in this question. I hope that you understood how this question worked. And again, if you struggled with this, sign up for some sessions with us. You can always find us on our website, Academic Coaching for World Changers. You can actually just Google Dr. Pam and it'll come up. We've got a YouTube site where you're hoping that you're watching this video. Remember to subscribe because you will get notified when we release new videos. And I'm going to remind you, it might not always feel like it, but you're doing exactly what you should be doing. Keep changing the world. Thanks.